Welcome to the Radiation Oncology Patient and Family Education class. During this class, we will discuss the reason for treating certain cancers with radiation therapy, describe the steps from consultation through radiation therapy, describe how radiation works and the goals of radiation therapy, and describe the side effects of radiation therapy. Radiation therapy is one of the most common and effective treatments for beating cancer. In fact, for several kinds of cancer, radiation therapy is the only treatment a patient will receive as the curative therapy. In Moffitt Cancer Center's Radiation Oncology program, our cancer specialists use advanced technologies that allow them to target the radiation therapy treatment precisely where it is needed, which results in more favorable outcomes for our patients. We would like to share this video with you that shares a patient experience and Dr. Harrison, a Moffitt radiation oncologist, discussing radiation.
I do an annual mammogram. They saw something suspicious there. My diagnosis was stage 1 breast cancer. I knew radiation was going to be part of the plan because I chose to have a lumpectomy rather than a mastectomy. So I knew that the protocol is radiation.
Radiation therapy is used to treat almost every cancer in some way, shape, or form. For some kinds of cancer, radiation therapy is the definitive treatment. It's the curative treatment. It's the only treatment that patients will receive. So as things stand now, it's a staple, if you will, in the armamentarium of cancer specialists in trying to manage and optimally cure the majority of cancer patients.
It's amazing how scientific and advanced in technology it is. They actually target the area that needs to be radiated.
We can design a customized plan of delivering radiation therapy to the patient using different beams, different angles, different intensities, different shapes, different techniques. So the ultimate effect is to deliver a high dose of radiation to the tumor and a minimal amount of radiation to the surrounding normal structures. And I'm proud to say that the team here at Moffitt is at the forefront of these activities.
And now that I'm doing radiation, I feel like I'm able to continue working and I'm able to continue living a normal life with radiation, particularly because they provide me with a lot of education and information about how to take care of my skin.
We've come a very long way in minimizing the discomfort. And so I think it's fair to say that nowadays we get patients through treatment with much less in the way of side effects than what used to be the case.
The best place was to pursue treatment at Moffitt Cancer Center because of the specialty, the physicians, the research, and that's why I decided to come here.
Excellent nursing care and excellent supportive care, excellent pain management, excellent nutritional care. The team of people that's involved with the patient are tuned in to all of these physical and human aspects of the cancer treatment experience.
I think beating cancer is something that it's going to be something that I'm going to have to continue to work on and reduce my stress and continue to eat well and exercise. But I feel like I really feel like I have a whole team of people that are supporting me in this endeavor.
To learn more, call 1-888-MOFFIT.
Certain types of tumors respond to radiation treatment better than others. The amount of radiation and the type needed depends on each individual case. Factors to consider are tumor size, the stage of the cancer, tumor location, health of the patient, method of radiation delivery, and total dose. Certain types of cancer are considered more responsive to radiation therapy. In these cancers, radiation can sometimes successfully stop growth without permanently damaging the surrounding normal tissue. If these tumors can be treated early before metastasis, the cure rate is high. Radiation treatment is frequently used in combination with other treatments such as chemotherapy, immunotherapy, and/or surgery. Radiation treatment may be administered before or after surgical treatment, Sometimes surgery may effectively remove the tumor, but there may be a limit to the amount of the tumor that can be removed. Post-surgery radiation treatment can be given to destroy any microscopic cells that may be left behind. Sometimes pre-surgery radiation treatment is given to shrink the tumor so that it can be surgically removed more easily, or allowing the surgeon to preserve more normal tissue. Palliative treatment is treatment that is intended to relieve symptoms, but not cure disease. Radiation therapy may be given to relieve pain in cancer patients. For example, radiation therapy can often relieve the pain caused by secondary bone cancer and the pain that often accompanies the bone cancer. During your first visit, your radiation oncologist will evaluate you to determine if radiation therapy will be helpful in treating your disease. This includes reviewing your current and past medical history, past surgical history, family history, medications, allergies, lifestyle, and your current symptoms. The doctor will also perform a physical exam to assess the extent of your disease and assess your general physical condition. Your medical record will be reviewed, including any imaging and laboratory studies. Frequently, your care will be discussed between a multidisciplinary group of specialists, including medical oncologists, surgeons, radiologists, and pathologists, to individualize treatment recommendations. The radiation oncologist will discuss the benefits, risks, side effects of radiation therapy with you and caregivers. If you decide to receive radiation therapy, you will proceed to treatment planning at the appropriate time. Following the initial consultation, a CT simulation or planning session will be scheduled for you. Then treatment will begin in approximately 5 to 10 days following the CT simulation. We will get into much greater detail about the CT simulation, treatment, and follow-up as we move through the presentation. The Timed Up and Go test, or TUG, is a commonly used screening tool to assist clinicians to identify patients at risk of falling. Upon checking in, all outpatients are given a brief screening for fall potential by the person putting the armband on the patient, who will ask the following questions. Have you fallen in the last month? Do you use an assistive device for walking? If answered yes, then a yellow armband is placed on the patient and a tug may be given. CT simulation is an important planning step before the actual radiation treatment can begin. During this planning phase, imaging studies such as CT scans, PET-CT scans, MRI, and X-rays may be performed. Some of these imaging studies require special preparation, such as IV or intravenous contrast. You will be informed if you need to do anything before your simulation. Simulation may take up to an hour. Your doctor and radiation therapist will assist you into a treatment position. A positioning device may be made which will be used for your daily treatment. Please let the doctor and therapist know if this position is difficult for you, because you will need to lie still during the entire procedure. Small permanent ink dots called tattoos may be placed around your planned treatment area. These tattoos are used to ensure the positioning and accuracy of your daily treatment. A CT simulator allows for precise treatment planning while the patient is in treatment position. Using a high-speed, high-capacity computer, the CT simulator helps physicians understand the complex relationship between healthy and cancerous tissues. The information is recorded, analyzed, and used to design an optimal treatment plan. These are the various types of masks and immobilization devices that are used during radiation. The purpose of the immobilization device is to hold you into the same exact position during every treatment, to deliver the radiation to the precise location of the cancer. Immobilization devices are used to keep you in the exact position required for each radiation treatment. This slide is showing the immobilization device used for anyone who is being treated for head and neck cancer. The mold material starts off as a flat piece of plastic that, when warmed, can be molded to the head and neck area. Patients will be placed in this mold each day they are treated. The dime shows the relationship of the size of the actual tattoo, which is shown to the right of the dime. That tattoo is permanent but does fade over time. This is a bite plate, sometimes used to hold the jaw into position for patients receiving treatment to the head and/or neck area. This immobilization device is called the Bellyboard. It is used to treat rectal and anal cancers. Patients lie on their stomach and their belly and small intestines hang down into the hole. This keeps these organs out of the treatment field and helps decrease side effects, such as nausea and vomiting, that can occur if small intestines are treated. It helps spare the normal tissue and organs that don't need to be treated. This is true for breast patients that are being treated lying on their stomach as well. Before you receive radiation therapy, your radiation oncologist, dosimetrist, and medical physicist work together using sophisticated computer software to calculate the best treatment for your situation. The physician hand creates a custom radiation plan for each patient. This treatment planning ensures that the tumor site receives the maximum amount of radiation while minimizing exposure to healthy tissue and organs. What do all the colors mean? The different colors show what dose will be delivered to a particular area, with red receiving the highest dose and blue color being the lowest dose. An analogy to this image would be a weather map. The hotter the colors, red, orange, the more radiation dose to that site. The cooler colors will be getting a lower dose to that site. A radiation therapist is a health professional that delivers radiation. They carry out the treatment plan designed by your radiation oncologist. Meet some of our radiation therapists here at Moffitt. When you undergo radiation treatment, each session is painless, just like getting an X-ray. The radiation is directed at your tumor or where your tumor was from a machine located away from your body. One of the benefits of radiation therapy is that it is usually given as a series of outpatient treatments, so you do not have to stay in the hospital. If an immobilization device was made during simulation, it will be used during every treatment to make sure that you are in the exact same position every day. Radiation therapists position you for treatment and set up the equipment. Time spent in the treatment room will vary depending on the type of radiation you will be receiving. Once you are positioned correctly, the radiation therapist will leave the room to begin your treatment. During your treatment, your therapist will closely monitor you on a television screen. There is a microphone in the treatment room, so you can always speak with the therapist if you have any concerns. The machine can be stopped at any time if you are feeling sick or uncomfortable. During your course of treatment, correct positions of the treatment beams will be regularly verified with images made using the treatment beam itself. These images, called port films, beam films, or portal verification, are used as an important quality check, but do not evaluate the tumor or cancer itself. These images assure your radiation oncologist that the treatment is set up, is accurate, and matches the intended target. Sometimes a course of treatment may need to be interrupted for a day or more. This may happen if you develop side effects that require a break in treatment. Unscheduled machine maintenance may also cause a missed daily treatment. These missed treatments may be made up by adding treatments at the end. However, it is best to arrive on time and not miss any of your appointments. Treatments are usually scheduled 5 days a week, Monday through Friday. The number of radiation treatments you will need depends on the size, location, and type of cancer you have, and the goal of treatment. During radiation therapy, your radiation oncologist and nurse will see you regularly to follow your progress, evaluate whether you are having any side effects, recommend treatments for those side effects, such as medication, and address any concerns you may have. These will be listed as a facility visit on your schedule or an on-treatment visit or OTV. Radiation is a targeted treatment. It does not affect your whole body. Radiation side effects are related to the area of the body that is being treated. Your treatment team will meet with you weekly to monitor any side effects you may experience. Most of the side effects of radiation therapy are limited to the area being treated. The part of your body being treated is called the treatment area. The side effects are usually temporary, mild, and treatable. These symptoms typically begin by the second or third week of treatment. They may last for a few weeks after the final radiation treatment and typically go away 1 month after completing radiation therapy. For example, a breast cancer patient may notice skin irritation on the chest, like a mild to moderate sunburn, while a patient with cancer in the mouth may have soreness when swallowing. Another example, if we are treating your prostate, your typical side effects would include urinary and bowel issues. The short-term side effect most often reported by patients receiving radiation therapy is fatigue. The fatigue experienced is usually mild or moderate and differs for each patient. If you experience discomfort or other symptoms during or after treatment, be sure to tell your radiation oncology team. They may be able to recommend strategies, prescribe medications, or suggest changes to your diet to help. Just as your body needs rest after exercise, your non-cancerous tissue need a break from radiation. The weekend provides a rest period for your healthy tissue. It also gives you a break from having to come in for treatment, where you can focus on rest, relaxation, and the things that give you a recharge so you are ready to begin the week again. This brief break lets your body stabilize so you can have fewer side effects as you complete treatment. So let's review some frequently asked questions. Does radiation hurt? No. Radiation therapy uses high energy waves like those used with an X-ray machine. They are invisible and painless. You will not see or feel radiation during your treatment. Although radiation itself is painless, the side effects from radiation may cause discomfort or pain. Can I drive after receiving radiation? Generally, yes. In fact, many patients work full-time while receiving treatment. It is very dependent on how one is feeling. Some radiation treatments may limit your ability to drive. In these instances, your treating physician will discuss these with you in advance. Will I lose my hair? You will only lose hair in the treated area. For example, if you are being treated to the neck area, you may lose your beard. Another example would be if you are male being treated to the chest region, you could lose your chest hair. Will I glow in the dark? The answer is no. Radiation will not make you glow in the dark. Will I set off airport security alarms? No. None of the treatments that we do in Moffitt's radiation oncology department cause any TSA or airport security alarms to go off. Am I radioactive? No, a patient is not radioactive after they receive radiation treatment. The treatment machine sends strong beams of energy to cancer cells to kill them or keep them from growing and dividing. The treated tissue does not continue to hold the radiation after the therapy session ends. So patients receiving radiation need not worry about transmitting radiation to others. Does radiation make me susceptible to infection? Generally, patients who are treated with radiation therapy alone aren't more likely to develop infections. Radiation does not have a direct effect on a patient's immune system. Can I take vitamins or supplements? During radiation treatment, it is recommended to only take a multivitamin daily and no extra supplements or antioxidants. Taking an extra supplement, such as vitamin E, can cause the side effects from radiation to be a little worse. Completing radiation is an exciting day. Your radiation team will join you in a celebration by ringing our bell. You will also be making any follow-up appointments necessary as deemed necessary by your treatment team. Here is a brief video that summarizes everything that we have discussed here today.
Radiation therapy is used to treat nearly every form of cancer. It may be used alone or with other types of treatments. Most people are treated with external beam therapy using a specialized machine. This machine uses modern technology to focus X-rays to the area of your body that needs radiation. To prepare you for your treatment, let us explain how the steps in the radiation process come together. The radiation clinic is located on the first floor of the main building next to the Blue Valet. When you arrive, please register at the front desk. A staff member will check your name and your birth date and place an identification band on your wrist. At this initial appointment, your radiation oncologist and nurse will discuss your health history and review your medical records, including imaging and pathology. The doctor will also perform a physical examination and discuss your treatment options.
Very well. Let's see. We're going to talk about your lungs today.
Before starting treatment, your doctor will explain the role of radiation therapy, as well as the possible side effects that you may experience. You will then be asked to sign a consent form. This form gives your permission to start treatment. If you are eligible for a research study, members of the research staff will be available to meet with you at this time. The second appointment is your treatment planning session, which is also called a simulation. Simulation is not a radiation treatment. It is an important planning step needed before radiation can begin. Your doctor will use imaging studies like a CAT scan, PET scan, or X-rays to outline the parts of your body that need radiation. You will be informed if you need to do anything to prepare for this appointment. Your simulation may take up to an hour. A positioning or immobilization device will be made just for you. This device will be used for your daily radiation treatment. Please let the doctor or therapist know if this position is difficult for you, because you will need to lie still during the entire procedure. Small, permanent ink marks may be placed on your skin. These marks and the positioning device are used to ensure the accuracy of your daily treatment. Usually, treatment does not start on the day of simulation. It may take 5 to 10 business days for your first treatment session due to the need for complex treatment planning. Radiation team members like the dosimetrist and the physicist use special software to assist your doctor in developing a safe and effective treatment plan. This type of planning helps minimize side effects from radiation. Every patient receives a customized treatment plan. Your plan is reviewed and approved by your doctor before you can begin treatment. Treatment. Radiation treatments are usually given 5 days a week, Monday through Friday. However, this can vary. Some treatments may be given twice a day. Your doctor will discuss your specific treatment schedule with you. Radiation is usually an outpatient treatment. Most people can drive themselves to their appointments. However, there are certain situations when a driver may be needed. Your doctor or nurse will let you know if a driver is recommended during your course of treatment. You will need to check in at the front desk before every treatment. A staff member will once again verify your name and birth date and place an identification band on your wrist. A radiation therapist or a volunteer will escort you to the treatment area. Due to federal privacy regulations, only patients are allowed in the treatment area, but family members may wait in the waiting room. On your first day of radiation, a radiation therapist will show you the treatment room and they will review your schedule. You will then be assisted into your treatment position. Please let the radiation therapist know if you're having difficulty getting in or staying in your treatment position. The table may be a little uncomfortable, but it is important to lie still. After you are in the exact treatment position, the therapist will leave the room. Cameras are in the room so the therapist can monitor you from the outside. An intercom system is also in place so you and the therapist are able to communicate during the treatment session. An X-ray or port film will be taken once you are in your treatment position. A port film is an X-ray picture of the area that is being treated. Port films will be taken every week during your treatment. These films are only taken to verify that you are in the correct treatment position. Treatment times can range from 10 to 45 minutes, depending on your treatment plan. Appointment times usually remain on schedule. However, delays may occur due to emergencies or machine checks. You'll be notified promptly if your treatment will need to be delayed. Please tell your radiation therapist in advance if you need to make any changes in your radiation schedule. During treatment, your doctor and nurse will meet with you once a week after your radiation treatment. This required visit is called an on-treatment visit, or OTV. Your doctor or nurse will let you know which day of the week will be your OTV day. During this visit, your doctor or nurse will see how you're doing. They will help you manage any treatment-related side effects. If you have any questions or concerns, please let a staff member know so we can address them in a timely manner. A dietitian and social worker are also on the treatment team, and they will be available during your course of treatment. The social worker can assist with hotel arrangements or discuss the option of staying at the American Cancer Society's Hope Lodge, which is located on the Moffitt campus. Thank you for taking the time to review this information. We hope that this video has helped you to understand the process of receiving radiation here at Moffitt Cancer Center.
The next few slides are common radiation terms you may hear during your radiation therapy. We'd like to thank you for taking the time to learn more about radiation therapy. If you have any questions, please contact your radiation treatment team.